Bramalea and Malton in Ontario, Canada are fast-growing communities home to new immigrants and lifetime residents alike. As these communities expand, action to create accessible healthcare in this region is underway.
I took him to the emergency hospital last year. He was just having problems and we waited at least 8 hours.
The old person there, he's a heavy medical patient. So his main concern is the medical accessories like hand support, diabetic shoes. And right now all the doctors are saying his senior citizen cannot cover him. And since he's retired, he doesn't have any income. So he has to buy it for retail price.
I'd like the doctors to have more time to consult with their patient in an intelligent fashion, you know, so that we can help ourselves and they can help us.
If you have continuity of care with a primary care provider, lots of good things happen.
Introducing a new kind of community health center being developed right now before your very eyes.
We are right now in Malton Gurdwara, Sikh Community Center. This is a praying hall, and as you can see, the Sikh community always believes in the holy book Guru Granth Sahib. Healthy body, healthy spirit, both should be in equilibrium.
The lady sitting next to me just kept saying that the youngsters can speak English, I cannot. I seem to have the problem with my doctor. So they want someone who can speak their own language.
We suffered a lot. We didn't get any doctor for my child. And we were new in Canada on that time.
You have to come morning, you have to give your health card, get an appointment, and you have to wait for 6 hours before you get an appointment.
In a hospital?
No, in the family clinic. And if you leave, your number's gone.
One of the things that this particular CHC is striving to do is not being seen as a service provider in the community, but as a member of the community. And it just so happens that we provide service.
At Bramalea CHC, we believe in bringing health services and health care to you. Whether it's in your home or where you shop, we have the staff to make it happen.
A nurse practitioner is a registered nurse who's taken extra education and training. So we're able to do things like take care of people with stable chronic illnesses. We can write prescription for certain types of medications, and we can take care of people with minor illnesses. We do prenatal care, well child care.
Diabetes actually is a growing problem, and the clients that we serve they are very high risk, and they already have, like, a number of people, they have diabetes. So it was a great need for having a program in the community so that we can remove the access barriers, and I mean, instead of waiting for them to come to us, going to them.
I think it's better. It can give you the chance to do some preventive action. A lot of traffic coming here.
This is very good, you know, and I think they should be doing this a bit more often.
You don't have to make an appointment, and you just come in, right? When you're shopping and they're here.
How are you going to just see a doctor when you want to? I mean, I don't see how that can happen.
We don't segment patients by the urgency of their need. Whatever the issue is, we want to be in a position to offer that patient an appointment today. So that tension between the medical definition of what's urgent and the patient's definition of what's urgent is eliminated. Demand for services in the primary care departments actually declines. It's one phone call, one solution. They see the provider of choice. It's a provider that they have a relationship with. We can do more with that visit. So good things all the way around.
We'll schedule out our day to find out what communities we're going to be hitting and what exactly we're going to be talking about, whether it be parenting or healthy foods to eat or finding services in your area. We go out into the community, set up our booth, conduct the workshop, exchange information because we want to build on what they already know.
The organization has spent some time investing in people and doing staff development, sending people away on courses, so people are coming back, sharing that knowledge amongst themselves and planning on how to put it into our day-to-day practice.
As well, staff participate in crucial workshops to discuss challenging issues or any potential conflicts within the team before they occur.
So what we're doing through these days of conversation is giving people a chance to talk honestly with each other about some of those experiences, some of those fears.
Bramalea CHC is committed to engaging with our youth in innovative and empowering ways.
Community health centers aren't just about having nurse practitioners and doctors and other providers or clinicians. We do health promotion work, we do health education work, we do community development, and we offer community services and programs.
There's a whole revolution in the way stories are being told and are being broadcast, and the fact that the Bramalea Community Health Center is actually incorporating technology and recognizing that health and media are connected is crucial.
The fact that they asked for artwork in their welcome room says a whole lot about what they want to convey to their clientele. Health is not just eating your vitamins. It's about art, music, work, athleticism, all of these things. They're all involved in the whole person.
So our location here on Queen and Finchgate really is a hub. It's sort of where our infrastructure starts, but we want to see our services radioed out into Bramalea. So yes, people will come to us, but it's also quite possible that 5 years from now that we may have a client that will be a client for 5 years would never ever actually come onto our premises.
My Malton was a well-attended community forum with center staff, lively conversation, and most importantly, community engagement.
I would be delighted if the center had a midwifery program and services available. Coming forward here and asking people what's up and asking them how to get forward, what is working was a great step. That actually makes it a dream that people can visualize, people can see happening.
So what's important at Bramalea Community Health Center is that we create a place where you can come and feel like all of who you are is welcome and you're going to get the services that you need from people who understand and feel at home with you.
This spring, build a healthier Bramalea.